cranial nerves are part of? So, is it central nervous system or peripheral nervous system? Peripheral nervous system. So what two things are part of the peripheral nervous system? Cranial nerves and spinal nerves, right? So let's go back to central nervous. I guess it's going to take us longer than a half hour. Okay, so we got the central nervous system. We got the nervous system, right, which sends and receives stimuli, and we can divide the nervous system into central, right, CNS, and then peripheral nervous system, or PNS. So central means down the middle. What's down the middle? Brain, spinal cord. Peripheral means what?
Outside the
Towards the outside, kind of the periphery, on the fringes, on the edges. So what is part of the peripheral nervous system? It's the nerves that emanate from the spinal cord. So the spinal cord, is like this, and then you have 31 of these, nerves. Those are called spinal nerves. We've got 31 of those. We have 12 cranial nerves, right? Those are part of what nervous system branch? The peripheral nervous system. Okay? Good? Awesome. Okay. So we're just going to focus on what for this next series of cranial nerves. The slide sets of recordings, I think I talk about the whole dynamic of stuff, but just focus on the cranial nerves. That's all the quiz is going to be on. That's all that's going to be on the final for lecture and the practical. Make sense? You guys okay with that? Okay. So basically, you can kind of see the structure of the way they're located in yellow. We know that they start with one towards what? The anterior, right?
Yes.
Up here. And they end with 12 at the very end, right? And they kind of have this descending order. They're in Roman numerals. So if you don't know your Roman numerals, you got to learn that. So we're going to create a little table, a little chart that I want you guys to take a special side note on. So if you want, you could save a piece of paper for this table I'm going to have you guys kind of create, okay? So just keep that in mind. So I guess this is you can write it down. Do I want you to do that? Yeah, you know what? I'm going to have you guys write it down, and you can only use the table that you guys write down for your notes on Wednesday, okay? I think it's the heat that's messing me up, but I'm going to say you guys can use the notes, a table that we create, only the table, no other notes, just the table, right? That, like, I'm gonna tell you guys, you're gonna write it out, okay? So on your table, you're gonna have kind of a column that says cranial nerves 1 through 12, right? All the way down, 1 through 12. You're gonna have another row that says sensory, motor, or both, right? So you're gonna write sensory for one column, right? Motor, or B for both. It's another column. You guys good so far? Let me write it down so you guys with me. So we have, I'll write it, I'll abbreviate it. So we're going to have cranial nerve, 1 through what? 12. How do you write 12? Like that, right? Okay. Then you're going to have the actual cranial nerve name, right? Like what's the first cranial nerve? Olfactory. You guys follow? Like that, okay? Then we're going to say, is it sensory, motor, or both? Okay? What does that mean? The olfactory nerve. You guys tell me, is it a sensory nerve? Sensory. Is it motor, or is it both? Sensory. Purely sensorial, correct? Mm-hmm. So we're going to put an S, okay? And then we're going to say what else? I know this is not a complete table. What else? Sensory, motor, both. We're going to continue on, okay, as we advance, okay? So we're going to do it for each of the cranial nerves. So right now you can write down 1 all the way down to 12. And right now you have 1, and we're going to continue to build this table out. So far, so good? Okay. There's mnemonics that I'll share with you guys too at the end to see if it makes sense to you guys. That you can use if you want. If you don't want to, you don't need to. So let's start with the first cranial nerve. The first cranial nerve, let me see the mnemonic of order. Okay, wait. So do you know where it says cranial nerves right there? Olfactory, we put the O there. I want you to write this down the list, just the first letter of everything, because I'm going to give you a mnemonic and we can fill in the blanks later. The mnemonic goes O, once, one, takes, the, anatomy, final, very, good, vacations, are
you serious
heavenly.
right now?
Yeah, that's the mnemonic, okay? You don't have to use a mnemonic, but it makes sense because it's 12 cranial nerves. So think about it for a second. O, once one, takes the anatomy final. Very good vacations are heavenly. That gives you the
That's
order.
A G?
That is a G or a 6. Yeah, we're going to go through it together. So don't worry if you didn't get all of it. We'll talk about it step by step. So the first one that we're looking at is the O, okay? So the mnemonic would go, olfactory would be what? The O, right? If you want to do the mnemonic, you can. Some people find it easy to kind of do it that way because they can reference the cranial nerve pretty quick, okay? Because it's not a big deal on the quiz on Wednesday maybe for you guys, but on the practical exam and on the final lecture exam, there's a lot of cranial nerve questions on the lecture exam. I know on the practical there's only 5. I think one workstation, 4 questions, but on the lecture there's a lot. Okay, way more than 5 or 4. Like I think like 8 or 9 or 10. So you should know the stuff that we're gonna kind of go through. Anyway, what's the main function here? Smell. So let's go back to cranial bones. What bone does this cranial nerve penetrate? Cribriform plate. On what bone? Ethmoid. Very good. Okay. So the cribriform on the ethmoid, you have basically the olfactory nerves penetrating into the olfactory mucosa, and then allowing you to do what? Smell. Okay. Where is the olfactory cortex located? Yeah, temporal lobe, right? Just to correlate it, because you will get asked that, not with cranial nerve, but just in general. Motor, sensory, or both?
Sensory.
Okay. How would we test this, like, clinically? And why do we care about cranial nerves? Remember, we're assessing what? Brain function. So in cases of strokes, right? Is this important?
Yes.
Yeah, this is called a mini neurological exam, okay? And you have to be able to know what you're testing for and looking for, okay? So how would you test for this? Smell. Basically, you're going to have the patient smell things, right? Here they're closing their eyes and they're giving them something citrusy, right? You have like oils, smell this, smell that. Is it vinegar? Is it coffee? Whatever it is. Yeah, I can smell it, okay? The pathology you got to know. So what is it called when you lose the sense of smell? So sensory motor or both is important, and then we're going to put patho up here, okay? Know the name of patho, which is, what is it called?
Anosmia.
Anosmia. Anosmia, or insomnia. Insomnia is a little different, but anosmia. Anosmia is the loss of the sense of smell, when you can't smell anything, okay? So if cranial nerve number 1 is damaged, what can't the person do? Smell. What is it called? Anosmia, okay? Does that make sense to you guys? So far, so good? Okay? Okay. I was going to ask you something else. No, that's it. Okay, that's it for cranial nerve number 1. Cranial nerve number 2 is going to be, so you're going to continue with the table. So the next cranial nerve is going to be what? Optic. It's the once, right? If we're going along our story, you're going to put once. Oh, once, right? Is it sensory, motor, or both? Sensory. So you're going to put an S, okay? Basically, the fibers, right, run through the retina. The retinas are found in the posterior part of your eyeball. And the optic nerve, which is cranial nerve number 2, does a little crisscross. You guys see that? Left to right, right to left. And do you guys remember where the relay center is? Where everything gets relayed?
Thalamus.
The thalamus, yeah. There it is right there too, by the way, right? The thalamus. And those fibers connect where? To the primary visual cortex, which is where? Occipital lobe. And that's how we see. And the way it works is like light refracts off your lens, right? The image is backwards, right? It hits your retina. It gets magnified. It gets reverted. It gets pushed to where it needs to go along this tract. It goes to the back of your occipital cortex, and then you're able to see something, right? And that happens like super quick, right? We don't even perceive any lag time or anything like that. It's insane. What happens if you can't see? What is that called?
Anosmia.
That's called anopsia. Anopsias. Okay? Anopsias is the inability to see. It sounds like anosmia, right? But it's different. because one is the loss of smell and one is the loss of sight, okay? What if you had a tumor pressing on your optic chiasm, right? Or maybe on one of those optic nerve tracts, what would happen?
You get
From one eye, right? They wouldn't be able to see from one eye, okay? A lot of glioblastomas are diagnosed that way. The patient will come in and they won't perceive it because they have both eyes open and they won't notice it until they like consciously close one eye and look out of one eye, and then they can't see anything. They open the other eye, they can kind of see, and they freak out and they're like, oh my God, I'm blind in one eye, I don't know what happened, right? So that can happen. MRI will diagnose that. So that's anopsias. How do we test? So testing. So testing is important too. So where it says clinical testing, maybe after that, right? You know, CLX, you know, TEST, clinical testing. This one, what'd you do? Have them smell something, right? Simple. This one here is pretty straightforward. You guys know what this chart is called? Snellen chart, right? This is the Snellen chart, okay? So we call this visual acuity, right? Visual acuity means what? To see. How do I know you can see? Through the Snellen chart. And then we also test for color blindness, right? This is an Ishihara test. Ishihara test looks for color blindness with these little bubbles, these little dots. And if you can't see that number, you're colorblind, essentially, right? And it depends on whether it's like, you know, blues, reds, yellows, greens, whatever it might be. It's a little book, essentially, or a digital version of this that you can kind of correlate with. So are we comfortable with this?
Closing an eye is like testing, right?
Yeah,
Is
so,
that 27 or 21 or 1%?
Yeah, what's that? 71.
so real quick, first question,
74.
71.
74. Say it again?
Close an
74.
eye?
To test for the Snellen chart, yes. So you close one eye to test the vision of one eye, you close the other to test the other vision. Yes, that's correct. That says 74, yes, 74. So if you can't read 74, you're colorblind.
I for sure thought that said 71. I thought it said 71 too.
It might be because of the lighting, but if you can see the 7, you're probably pretty good, you're fine.
I don't think it cheats like, listen, stop.
Yeah, the lighting skews it because you guys it's bright up here, but if you see it in reality, you guys will be fine. I don't think you guys are colorblind. It's when you don't see it at all, right? It's a different color completely. It's when it's messed up. We also test for this by something called the fundoscopic examination, right? This is a fundoscope, and basically we can actually see blood vessels in your eye with this device. It's the only way we can actually see an artery. No arteries are exposed. All that you see are veins, right? There's no arteries that are superficial. The only way we can kind of look at an artery is through the fundoscope, which is kind of cool because you can actually see the optic nerve, you can see how the arteries flow, and you can actually diagnose, I shouldn't say diagnose, you can confirm your diagnosis of hypertension with a fundoscopic examination, or diabetes, things like that, which is pretty cool. Are you guys cool with this one?
Yeah.
Yeah,
No?
sure, yes.
Good? Okay.
Great.
Let me know if you guys don't understand something, I can repeat, okay? We don't gotta get out of here early, we can stay here till the AC turns back on. Okay? So the next couple cranial nerves are pretty insane. These are the ones that we talked about before that relate to eyeball function. How many cranial nerves do you guys remember deals with eyeball function?
3.
3 cranial nerves, okay? So we're gonna write number 3. So are you guys doing your table?
Yes.
Okay, so the next cranial nerve is gonna be cranial nerve 3, right? What's the cranial nerve? Oculomotor nerve, okay? Oculomotor nerve. And what does the oculomotor do? Eyeball movement. So there are 3 cranial nerves, which are cranial nerves 3, which is the oculomotor, cranial nerve 4, which is the trochlear nerve, and cranial nerve 6, which is going to be the abducens nerve. So we skipped one, if you guys noticed, yeah? We went 3, 4, and 6, okay? 5 is something else. We'll talk about 5 later. So 3 cranial nerves that deal with what? Eyeball movement, okay? Do you guys see, like, the dynamics of this? There are muscles that are innervated by each of these cranial nerves, right? They have specific names, either the inferior oblique, which kind of goes up and out, the inferior rectus, in and out, superior oblique, lateral rectus, medial rectus, etc., right? it's pretty complicated. I don't want you guys, I don't think you guys need to know what muscles innervate what and in what direction. Don't worry about the direction. I just want you guys to understand the function of these cranial nerves. So 3 cranial nerves, what are they? And what do they do? So the 3 cranial nerves, remember, oculomotor is number 3. Number 4, which is next, we're going to see that one. That's the trochlear. And then skip a line. Number 6 is going to be which one? Trigeminal nerve. No, not trigeminal. That's 5. Abducens. The one that we skipped is trigeminal. So, is it sensory, motor, or both? This nerve. Motor.
No?
Say it again.
It's both, no?
No, because it's not sensorial. Because you're not sensing anything with this. We already talked about sensorial is optic.
Okay.
This is purely motor.
Well, yeah.
Because it's eyeball movement, right? So the same way, you see the chart here, the way you would test this is basically the pen in front, head's not moving, eyeballs are tracking. You're going out, down, all over the place, around the world, right? And they're tracking it with their eyeballs to make sure that all those muscles are working right. That's purely what?
Sorry. I wouldn't do that. Apologize.
Purely motor, right?
Yeah.
Yes.
We're going to go to the club yet, it's not Friday, hold on. Wait till Friday, then we go. Purely motor, and it's dynamic, okay? So just keep that in mind. These next cranial nerves, all motor. So which one is this one? Motor. What's it do? Move eyeballs, okay? How do we test for it?
Pen.
Yeah, you're just basically tracking. That's what it is, tracking, okay? What happens if it's paralyzed? What happens if you have damage to this particular muscle? Let me tell you one thing. There's one important thing. The eye is going to rotate laterally. And when the eye rotates laterally, this is called external strabismus. So the eye wanders to this side. The eye wanders to this side. A lazy eye, that's exactly it. Yeah, a lazy eye. You guys know something with a lazy eye? I have an aunt that has a lazy eye. And I always trip out because I don't know where to...
You're like, what are you looking
Like
at?
what? Yeah, what do you want? What's up? I'm going to ask about pathology, so definitely write down pathology. I want to see this also as you guys finalize your notes. You guys got to run it through me because I want to see it as a table. I don't want to see it written out. I want to see the table, like concise, quick, and easy, if you guys are going to use it for Wednesday, okay? Because I don't want extensive notes or any of that stuff. It's just the table, okay? Just like what we're going over. So, again, what we're going to go through here on the patho is what? What would you write under patho? External strabismus. What does that mean? Where does the eyeball go or wander? Laterally. That's what's called what? Lateral strabismus. Lateral lazy eye, right? Okay? Does that make sense to you guys? Because what muscle's paralyzed here doesn't work? Look, I'm going to put an X on it. That one doesn't work, right? What else doesn't work? This one doesn't work. That one doesn't work. That one doesn't work. That one doesn't work. You guys see all those eyeball muscles that don't work, right? So where's that eyeball going to want to wander at rest? Laterally, right? You guys comfortable with that?
Yes.
Does that make sense to you guys? Okay. Lateral strabismus. So, are we comfortable with our chart? Do we got everything that we need to know? Okay.
No, I don't. Hold on. For the patho you said was for the oculomotor,
Say it again.
for this nerve here.
Yes.
What was the patho for that one?
The path is called external strabismus. That's wandering eye or lazy eye to the lateral. How else do we test for this as well? We're going to look for pupil size.
And
Okay.
What is the test for this?
The test is finger tracking or pen tracking, just tracking. Also with your pen light, right? You guys ever shine a light in an eyeball, right? What's going to happen? Constriction. The pupil's going to constrict, right? When it's dark, you want more light to enter your pupil, so your pupils are big, right? If you shine a light right into your pupil, what happens? It's going to constrict to allow less light in. So we have little pen lights, right? Take the pen light out, and you're checking for what? Symmetrical pupillary reflex. So the pupillary reflex, where is it at? The pupillary reflex is also part of your testing. Okay, did we put testing? We put testing. We put testing. Patho, test, testing, right? And this would be like smell test, right? Nothing fancy about it, smell test, simple. I just want you guys to understand the concept, right? Is there another thing that I'm missing, or is that it? Patho, testing, okay, that's about it.
What's the third mnemonic for the?
Oh, the third mnemonic there, what is it? For the cranial nerves?
Yeah, the third one.
Third
I
one.
know there's O
One.
once and.
O once, one. O-N-E, one.
Okay, so for the testing for olfactory smell,
Yes.
for the testing for, optic
Is the Snellen chart that we saw. So write Snellen, S-N-E-L-L-E-N, Snellen chart. And that tests for visual acuity. That's the way it's kind of described, as visual acuity.
Can you write the mnemonic out for us?
Selling.
Yeah. The cranial nerve one?
Yeah.
Oh shit.
and then the one for this one is the pupillary reflex test.
Wait, what am I?
The pupillary.
Okay,
Oh my god, that's much better.
good. So it's, you can read my writing, goodness. O once one takes the anatomy final, very good vacations are heaven. Okay? That's the mnemonic for the 12.
Well, at least we can see the first letter.
Yes, that's what I,
What was, okay.
you can write.
Okay,
You can
forget
see.
it.
Okay.
You're doing great.
Oh, I know I am. The other mnemonic to kind of keep in mind that I can share with you guys is this one here. Let's see if this one works out for you guys. Some Mary,
Let's just, we'll go over it slow. Once, one.
Okay, that's the other mnemonic for sensory, motor, or both, right? Can you guys read that one? Say yes. Okay, it says, it says, oh, I forgot the sum. Some? Some say marry money, but my brother believes big brains matter most. Which means what? The S is what? Sensory. The B is both. And the M is what? Motor. So again, it's a mnemonic that you can use to kind of remember, or not, if you don't want to use it. You don't have to. It's up to you guys. But there's a mnemonic to kind of take a look at. Okay? So, any other questions about any other testings or things like that before we continue? You guys good? Kathy, did I answer your question, or did you need more?
I don't remember what my question was.
Your question was, can I write it on
Oh,
the
yes,
board?
yeah.
And then you criticized my handwriting.
Facts. Facts.
So, were you able to read these
Yeah,
ones?
yeah, I
Good?
got it.
You guys good?
Yep.
You guys want me to, you guys okay with this?
No, what does that say, Henry?
Heavenly.
Heavenly.
Heavenly. Imagine after taking your final, how's it gonna feel?
I feel like we're so class.
Like you're in heaven. You're done. You're done. You're in heaven. Okay?
For like 24 hours.
You're in heaven. You guys good? Good? Natalie? No? What do you need?
The first one, can you say it slowly?
Which one's the first one?
One.
Oh, the mnemonic slowly?
Mhm.
It goes, like, put yourself in that situation. You know, like you're
We are in
a,
a situation.
you're a student in an anatomy class that you're under a lot of stress. Imagine that. I don't know if you can, but try to imagine yourselves as a stressed out student in an anatomy and physiology class. And after you take this exam, this final, you're going to feel like you're, you know, in heaven, right? So the mnemonic goes, O, once, one, takes the anatomy, final, very good, vacations are heavenly.
I feel like you should change the vacation to vodka.
But you could, like I said, you could change it. Vodka is heavenly. You could say that too. You could,
Right after.
you could. I keep it. I'm keeping it PG, right? G to PG. I know some other ones that are beautiful, but they rated X, and we can't do no rated X stuff. No, I cannot. Good try, but hell no. Yeah, no, no way. I won't even verbalize it. But if you know some mnemonics that work, you can keep them in your head. If they're PG or even PG-13, that's all right, as long as they're not insulting or derogatory or anything like that.
Dr. Khan, question. Are we allowed to include the function on the table or just?
Yeah, function too, yeah.
Okay.
Let's put that one there, it's good to know function, yeah, this function is vital. So, function of the cranial nerve, you can put that as what? Smell, right? So, yeah, let's go back to those other cranial nerves and put function on there. So yeah, definitely, that's good. Function is part of the exam. So you do want to know function, okay? Yeah, smell. You forgot? Sight. Yeah. To see, vision. How do you test for it? What? Snellen chart. Yeah. You're testing for visual acuity, right? You're also
Snellen for the optic, I'm sorry.
No.
And olfactory?
okay. Let's go back.
Olfactory is smell test.
Small test.
Optic is smelling.
Yeah. So if you guys look here,
Olfactory is smelling.
the first one here, olfactory. The function of olfactory is smell, right? So it's not like you close your eyes and something like that. You close your eyes, or the patient closes their eyes just so they can identify what you're giving them, right? In this case, they're giving them like an orange. I mean, it's citrusy. If they see an orange, they're going to say, yeah, it's an orange. I can smell it. But if they're supposed to be blindfolded also. And they're supposed to be actually like essential oils, right? That are marked to one side so the patient can't see. And you open it up and you let him sniff. One nostril, then the other nostril. That's the proper way. But we're not getting to that level. It's just sense of smell, object to smell. That's it. Sniff. Sniff and identify. That's straightforward for the function. Does that answer the question? Okay. For Selma, your question, number 2 is optic, right? The function is what?
Sight.
Sight. Okay. How do you test for sight? How do you know someone can see?
Snellen.
Visual acuity, right? Snellen chart. Okay. Can you see these letters? Yeah. Okay, read them out to me. Okay. Are you colorblind? No, I'm not. What's that number? Okay. Let me check out your eyeball to see how they look, right? That's what I'm going to be doing. Are you guys comfortable with this one?
Yes.
Okay. The patho for this, what do I call it when I lose the sense of sight?
External strabismus.
Nope. When you lose the sense of sight.
Oh,
Anopsia.
anopsia.
Anopsia. Okay. Good? Okay. The third one is the oculomotor, right? So the name kind of tells you already. So if we go down the list, we already said 1, we had 2 right here. This is now what? 3, right? So 3 is the oculomotor, right? Oculomotor, okay? So oculomotor is going to do what?
Eyeball movement.
Eyeball movement. Do you have to know what muscle dictates what direction?
No.
No. But I do want you guys to know it's eyeball movement. How do you test for it? Tracking, right? Tracking.
Is that the Perna testing or no?
Which one?
The Perna?
Yeah. Yep. That's the same thing. We'll just say tracking to keep it kind of simple, but you're right. The one patho I want you guys to be aware of is what occurs when that muscle gets paralyzed. The eye starts to wander laterally. So it's going to go this way if it's on this side, and it's going to go this way if the patho's on this side, laterally. Make sense? That's what's called lateral strabismus. Is this sensory, motor, or both?
Motor.
Motor. Go through your mnemonic. You guys have the mnemonic. Some say marry money, but my brother believes big brains matter most. So we're on the third. It's an M. What is it? Motor. Okay? That's why the mnemonic kind of can help if you're not familiar with the cranial nerve, because, you know, it just makes it easier. Unless you're hardcore, then you can memorize it straight away. Okay. What else do we test? How else do we test this one here? So go to your testing. Okay. How else do you test this one? Pen light. What are you looking for with pen light? Constriction, right? So remember, when I shine a light in a pupil, I'm going to have constriction. Dilation is when you have less light. Your eyes are going to accommodate to less light to allow more light in. They dilate, right? Less light, they're going to constrict, right? No, what did I say? More light. More light constrict, less light, they're going to dilate. So when I shine a pen, or my pen light, a light, into the eye of my patient, what's going to happen to their pupils? They're going to constrict, right? So I'm checking for symmetrical pupillary constriction, and when I remove the pen light, I want dilation as well, right? You guys make sense? Good? Okay. Mhm.
Are they looking for like atrophy or?
Yeah, they can look for like moth-eaten like structures. They can see like vessels that are like hypertrophy for hypertension. You can see signs of like diabetes as well in the eye. All those are kind of things that not diagnostic, but they kind of help assist you in kind of seeing the function, not the function, the status, the overall status of the vessels, because you can kind of visually see an artery. But they're characteristics. So if you look at the patho of like Google like fundoscopic hypertrophy, and you're going to see what like high blood pressure vessels look like in the eye. It's interesting. But that's for the previous cranial nerve, right? Yeah. Okay. Another thing to kind of keep in mind for patho on this one here is you're going to see the eyelid droop, and it's going to cause something called ptosis. Okay? Ptosis with a P. Ptosis is when the eyeball droops a little bit. Okay? So when the eyeball droops, you have what's called ptosis. So you got ptosis, you've got external strabismus. Those are the two pathos, yeah? Okay? How do you test for this again? Basically tracking, and then what? Pen light. Okay? You guys comfortable with that? Okay? Any repeats on this one? Good? Okay, the next cranial nerve is cranial nerve number 4, which is called the trochlear nerve. Okay? It's the takes in my mnemonic, correct? And it's the money in my other mnemonic. So is it sensory, motor, or both?
Motor.
It's motor. Okay? And what does it do?
Moves the eye.
Moves the eye. That's it. Eyeball movement. I don't know why you guys kind of got shy on that one. It's eyeball movement, right? So eyeball movement is the function. And the interesting thing here is you get double vision or diplopia. I'll spell it out. I hold my breath for that so I can write it neat. Diplopia. Di meaning what? Two. Opia is vision, so diplopia is double vision.
Wow, that is amazing work right there.
So yes, that's an interesting one. So that's the big one I want you to kind of keep in mind. I mean, inferolateral, again, you can't move the eye down and out. That's also probably good to know. So down and out, meaning inferolateral, put an X through there, can't move down and out. How do you test?
Pen light.
Just tracking. Just tracking. Just tracking. You guys good with that?
Yes.
Okay, we're going to skip 5 for a second because we're going to close out the eyeballs, okay? So the last eyeball one was what number?
6.
6. Okay, we forgot how to count. Okay,
We're skipping
so trochlear is 4, yeah?
Yes.
Okay, so it can't be 4 because we just did 4. Okay, what comes after 4?
5.
5, right? So 5. We're going to skip 5 for now. We're going to jump to the next one. What's after 5?
6.
That's right. You guys are on it. 6.
Can you do me a favor and the function of the oculomotor
Yes.
nerve, is that the same thing as the trochlear one? or-
Eyeball movement. Same.
Okay,
Yep.
I'm just making sure I was.
You're good. Eyeball movement. And guess what? The abducens, which is cranial nerve 6, guess what its function is? Eyeball movement. Right? Eyeball movement. You test the 3 of them, by the way, at the same time, yeah? Because you're going up and out, down and out, all that kind of stuff. Okay? Which one deals with the pen light?
Oculomotor.
Oculomotor. Okay? Because think about it for a second. Oculomotor, because what's it doing? It's reacting to light, correct? So it's got to be what? Motor. What's your pupil? What's your iris? It's a muscle, right? So your iris is controlling your pupil to allow less or more light in. So what is that? Motor or sensory? Motor, right? So same thing here. Abducens is eyeball movement. In this case, if this muscle is paralyzed, right, or damaged, what type of strabismus do you get?
Internal.
Internal strabismus. Do you guys see that? Okay? So if that muscle's damaged, I'm going to put an X through it. X through that one. Where's the eye going to want to wander? Internally like that, okay? We call that what type of strabismus or lazy eye? Internal strabismus. So, what 3 cranial nerves deal with eyeball movement?
2, 3, and 6.
Not 2.
Or, sorry, 4 and 6.
3, 4, and 6. Okay? We'll get it one day. We'll get it one day. I'm going to give you guys a big break because it's super hot, right? I know your brains are probably melting. So 3, 4, and 6, eyeball movement. Which is the one that deals with the pen light?
Oculomotor.
Oculomotor. Okay? How do I test for them? Pen light. Which one, if damaged, leads to lateral strabismus? Oculomotor. Okay? Which one leads to internal strabismus? Abducens. Which one leads to the inability to move the eye inferolateral, down and out? Stroke. Which one leads to ptosis? Oculomotor. Okay?
What was the pathway for the trochlear?
Say it again.
What was the pathway? Diplopia?
For the what?
For the trochlear?
Trochlear is going to be diplopia, double vision. That was going to be my next question. Which one deals with double vision if damaged? Yes, no, you're fine. Do you guys understand, like, these cranial nerves, their function? You gotta know these guys, okay? Easy but hard, I guess.
Is there testing for
Those nerves.
Yeah, same.
Oh,
Tracking. You test them all the same way. Next one up, we're gonna go back one, right? So rewind. After 4 came 5. You guys remember that? We skipped that one. Now we're gonna see 5. This is the trigeminal nerve, okay? So the trigeminal nerve is the biggest cranial nerve that we have. It's a chunky one. It's the in our mnemonic, and it's the but in our other mnemonic. So but means what? B? Both. So is it sensory?
Yes.
Is it motor? Yes. It's the first one that's both, right? Interesting. So let's take a look at why, okay? So again, it's the largest of our cranial nerves. And basically the main function here to kind of keep in mind is sensory, because we have 3 divisions on the face, on the maxilla, and on the mandible, right? So do you guys see the cotton wisp that they're putting up top? And the cotton wisp like midline? And then down below in the jaw, right? So they're testing for what? Do you feel this, right? It's called pinpoint discrimination, right? I don't think I said that on the quiz, but it's pinpoint discrimination. That's the big thing to kind of keep in mind. The other one that is on the quiz that you should definitely know is the corneal reflex test. This is motor, no? Right? Yes or no?
Yes.
Yes. So what does that mean? Corneal reflex. That's what you're seeing here. That cotton wisp right there, do you guys see how they kind of put a little, I don't want to say sharp because it's not sharp, but it's, I don't know, what's the word? I can't even think anymore. It's pointy, right? Not pointy to poke the eye, but enough to irritate the eye. You touch the cornea. The cornea is very sensitive. What's going to happen?
Blink.
You're going to blink. If you blink and do this, what does that mean? It's working. If they irritate that and nothing happens, it's not working, right? So it's called the corneal reflex test, okay? Does that make sense?
That will be on the exam, but not the pinpoint.
Yeah, I do want you guys to know there's a sensory aspect to it, and you would touch you can feel the 3 divisions, because it's divided this way. Do you guys see up here, it says V1, 5, 1, 2, and 3? That's a sensorial division, and motor division, basically. So, yeah, you can feel along these patterns, so just know it's sensorial there. I don't ask specifically pinpoint test, but I want you to know it's a mixed cranial nerve, right? Mixed cranial nerve. So feeling or sensation on the, what they call the ophthalmic division, on the maxillary, is it the maxilla? The maxilla? Maxillary division? And this would be what? The mandible, okay? So those 3. The other important thing to keep in mind for the motor dynamic is very, very, very important, is that these nerves, if you guys remember when we looked at the muscles of the skull, we looked at muscles for mastication. And if you guys remember, we said this cranial nerve innervates the muscles for mastication, and these cranial nerves innervate facial expression, or facial muscles. So now we're talking about the cranial nerve that's going to innervate masticating muscles. So what's the cranial nerve that innervates the masticating muscles?
Trigeminal.
Trigeminal. What are the masticating muscles?
Pterygoids.
Pterygoids.
Masseter.
Masseter.
Temporalis.
Temporalis. Very good. Sit down with temporalis. Good. Somebody said it, no, temporalis. I don't know who said it.
that was me.
Oh, okay,
I
Julia.
was admitting on.
She's like, Ty, temporalis, good. Excellent. Those are the three muscles of mastication. So the motor aspect is what? Masticating, right? The sensorial aspect we've already talked about. So is it a mixed?
Yes.
For sure, okay? For sure.
Feel and.
There's a lot, right? I'm going to condense it to what I just mentioned right now, okay?
What was the path? Did you already go over the path?
No, I haven't done the path yet. I'm just double checking if I didn't miss anything real quick. When you guys go to dentists, by the way, they hit this nerve, right? They hit the nerves in the gum lines to numb your jaw up top or your mandible down below, by the way. The imbalance is trigeminal neuralgia, okay? Sometimes on the exams, I put the fancy name, which is tic de la rue, right? Tic de la rue is the French name that means muscular twitch, right? Because trigeminal neuralgia kind of gives it away. Because where's the damage? The trigeminal nerve, right? So sometimes I may put tic de la rue. Tic de la rue just means the same thing, trigeminal neuralgia. What does that mean? Pain, where? In the jaw. So what happens? Can they chew? Very painful, right? They're gonna describe immense pain when they open and close their jaw, right? More than likely, what is that? Trigeminal neuralgia. Okay? Does that make sense to you guys?
So that's the path then.
That's the path.
And on the quiz, are you gonna use Dularoo?
I used to. I don't know if I will, but just write it in parentheses. Tic de la rue. And then put trigeminal neuralgia in case I'm nice and I'll leave it that way. I don't know. Right now I'm getting irritated. It's too hot, so I'm getting mad. Salma, question?
Can you do that path one more time?
The what?
The path?
The patho?
Yeah.
Yeah. So when that nerve gets inflamed, you guys see how big this nerve is? It's the chunkiest, biggest nerve. When that nerve gets inflamed, when it comes to the muscles for mastication, it has a special name. Just like you have carpal tunnel syndrome, this has a special name. It's called trigeminal neuralgia, right? Trigeminal neuralgia. Now, on the quiz, I could write trigeminal neuralgia, but then it's really easy if I say what cranial nerve is affected, because you know, right? So I might put the other name, tic de la rue, right? Which means the same thing as trigeminal neuralgia. So tic de la rue is right there, okay? Tic de la rue. TMJ is temporomandibular joint. That's what it stands for. But yeah, when you have like inflammation of the jaw and pain, it's this. Yeah, this nerve is inflamed. You guys good?
What's the testing for the trigeminal?
The testing is here. Sensory, basically it's a cotton wisp, right? And they're going to run it across your forehead,
Oh, okay.
the top of your jaw, and then the mandible, right? And then can you feel that, right?
What's it called?
That's just a 2-point discrimination test. But I'm not gonna, Kathy asked me that earlier, I'm not gonna put that on the test. But I just want you to know it's a both, right? The other aspect to it is, the one that is on the test that you have to know that's sensorial, Amanda, is this one here.
Yeah.
This one here is the corneal reflex test. Because what's happening as the cornea is being irritated, is that sensory? Yes, because you're feeling it. And then you have the motor aspect, which is what? Blinking. So that's one that you're going to test for in both. So write that one down.
Right, that's for the trochlear.
No.
No,
That's for the
trigeminal.
Trigeminal.
So it's motor and sensory?
It's both. Yeah, it's both. You guys get this one?
What's the function of the trigeminal?
It's going to be for masticating.
Okay, got it.
That's the motor part of it. And then the sensory aspect, like we've said, it's innervating the ophthalmic, maxillary, and mandibular regions of the face. And it's going to elicit the corneal reflex, right?
Yes,
Which is important, correct?
yes.
How do you test for the corneal reflex?
Poke their eye.
Poke their eye, yeah. Perfect. Yeah, done. You feel that? Perfect. Good? Any questions about this one?
No.
No? Okay, the next one up is gonna be abducent. Oh, no, we already talked about it.
Facial.
We're jumping to 7. We're almost done. This is the final, and this is the brother, right? In the mnemonic. What's it do? What's the function? Is it sensory, motor, or both? You guys tell me.
Both.
Both. So we've got motor impulses to what?
Transmit. Parasympathetic.
So motor impulses to the face, right? So you can emote. So things like wrinkling your forehead, blowing out your cheeks, shutting your eyes, are all innervated by what nerve? Showing your teeth like that, like the rosorius, right? Because they're muscles. Rosorius, what's that one? Buccinator.
Occipital. Ocular. I don't remember. It's freaking out in here. Orbital oculi.
Good. Orbicularis oculi. And that?
Superciliary.
Frontalis.
Yeah.
Yeah. So all those muscles are facial muscles. They're all going to be innervated by one cranial nerve. Facial. Is that motor or sensory?
Both.
Yes. We're looking at the motor division right now. You're right. It's a both, but we're looking specifically at the motor. This is the motor. This is how you test for the motor part. What's the sensory part then? Taste. Very good. It's taste. Okay. So that's the sensory part of it. Taste. Okay. Sensorial testing for this is the anterior 2/3 of the tongue. Okay. So if this is our tongue, the anterior 2/3 are what? What nerve? Facial. Okay? That means that the posterior third is another cranial nerve, correct? Okay. Another interesting thing to keep in mind and note about this one here.
I'm still lost
Is it
right now.
two nerves?
Why you lost? What happened?
So your tongue is 2 different nerves.
Yeah, for taste. Yeah, it's crazy like that, isn't it?
It's just, my table's not.
It's
math on
insane.
The table's not math.
You might have to redo your table. Yeah, I mean, excessive notes maybe. Yeah,
So the
you're gonna
testing is the 2/3 of the tongue?
anterior 2/3. Anterior 2/3. We also have, very important to know, lacrimal glands that are activated by the facial nerve. So when we cry, or when onion irritates us, or when we want to go home but we have to stay for anatomy till 9, 9:30, 10, we start to cry, right? Those lacrimal glands get activated, right? So what cranial nerve innervates tears?
Facial.
Facial nerve.
Facial nerve, right? Very good. Facial nerve. Okay. Maybe. We got till 10. We got till 10, so I'm patient. We're good. Patho. So what happens if you're dealing with patho? This is something called Bell's palsy, right? Where you have hemiparalysis of one side, okay? So Bell's palsy is one example that's transient, sometimes it's acute. What about in a stroke? Do you think these muscles would be affected in a stroke?
Yes.
Right? You're going to have, hemiparalysis of these facial muscles on one side versus the other. So can the patient have symmetry between one and the other side? No, right? Just like with Bell's palsy that I showed you earlier, right? Are you going to have symmetry between one side and the other? No, right? Because one side is affected, one side is not. So that's the pathology. So pathology, you can say Bell's palsy, you can say stroke, and that equals what? Hemi means what? Half. So are you going to have hemiparalysis?
Yes.
Yes, hemiparalysis. Of what? What are we talking about? Face. Facial expression, facial muscles. Okay? Is there going to be a problem with the tears?
Yes.
Is there going to be a problem with the tongue?
Yes.
In terms of what?
Anterior.
Movement or what?
Taste.
Taste. Okay? Taste. Anterior what?
2/3.
2/3. Okay? Anterior 2/3. Very good. Anything watery. So aside from tears, what else do we got? What other liquids do we produce up in this area? Saliva. So they're going to activate the parotid glands to produce what? Saliva. Okay? So you got tears, you got saliva, you got taste. Right? Make sense? Okay? So testing again, how do we test? It's a taste test, right? What about this? The taste test would be what? Sensory or motor? Sensory, right? The facial expressions?
Motor.
Motor.
It's getting worse.
I know. Look, I'm gonna cut you like a lot of slack because it's super hot. I feel you guys. Don't worry about it. It's all good. I know you guys are usually much more active, but the heat's kind of bringing you down. No worries. Okay, are we good with this one? Anything else to review before we move on? Anybody?
No.
Good?
Jules got a question.
What was the clinical testing for? I forgot.
The clinical testing for this one basically is taste, right?
Oh.
So it's a taste test for the anterior 2/3. That's testing for what? Sensory. How do I test the motor? Facial expressions. Can you blow out your cheeks? Can you close your eyes? Can you lift up your eyebrows in surprise? Right? Those are testing for this cranial nerve. Can you smile really big? Good? Julia? Julia, good?
Yeah.
Facial expression.
Next one up, vestibulocochlear nerve. What's this one all about?
Hearing.
So this is cranial nerve number
8.
8. Oh God, 4 more and we're done. Goodness. Okay. Oh. God, get us through. Okay.
Go ahead and get us.
So 8, vestibulocochlear, right? Is this a sensory motor or both? Both. Okay. Why is it a both? What's this nerve doing? What's the function?
Balance and hearing.
Balance and hearing. That's simple, right? Balance and hearing. Okay. So this nerve lets me hear, and this nerve gives me what? Balance. Okay. How do we test? Tuning fork. Do you guys see what they're doing there? The tuning fork is placed. This is like the old school method, I guess you could say. You can do like the new school method, which is like the, headphones and the beeping sounds, that kind of stuff. The tuning forks, basically, you strike them on a rubber pad. They kind of vibrate. You put them in the back of the mastoid process, or you put them in the frontal, part of the frontal bone, and then that helps you discriminate between like neurosensorial hearing loss versus conductive hearing loss. So neurosensorial means that you lose hearing in your ears due to nerve damage, and then conductive is basically due to like an infection or something.
So you said that the main function is hearing.
Hearing and balance.
Okay.
Yeah, so that's why it's a both.
Hearing for sensory.
So balance is motor, hearing is
Sense.
sense, right? Sensory. Patho. If we have a lesion to this nerve, what's going to happen? Deafness. Perfect. And or vertigo. Very good. I don't think vertigo is on there, but they're describing vertigo here, so put vertigo. Because all that they're mentioning there are the symptoms of vertigo. Okay? So vertigo and deafness if that nerve is damaged. Okay? You guys good?
Yes, sir.
All right, next one up is glossopharyngeal. Glossopharyngeal. That's the good and the big, okay? What's the function of this cranial nerve?
Tongue movement.
Glossopharyngeal. Basically, what did we say it was? It was a both?
Yes.
Yes, both. Okay. So the sensory aspect of it is, yeah, you're right, is taste.
Taste.
So you guys remember the tongue here? The posterior 1/3 of that tongue is what?
Taste.
Taste. Who's in charge of that posterior 1/3? Glossopharyngeal. Who's in charge of the anterior 2/3?
Facial.
Facial. Very good. Okay. Do you think you'll confuse those?
Yes.
Yes.
In a heartbeat.
Very easily. What else did we say this thing does on the motor side? Remind me?
Swallow and.
Swallowing. Very good. So it helps with swallowing. If you guys notice the nerve, you guys know what this is back here? This is a 202 question right here. Uh-oh. What I highlighted up there in red, oh, you can't see it? Here you go. It's posterior to the trachea.
Pharyngeal.
What is that? Come on. It helps you swallow.
Esophagus.
Yes, there you guys go. Goodness. Okay, the esophagus. So do you guys see how the nerves go to the esophagus? I don't know if you missed it or not. Let's erase. Let's try that again. You guys see the cranial nerve right here?
Yes.
The glossopharyngeal. Glosso means what?
Tongue.
Pharynx. Pharynx. What's part of the pharynx here?
Esophagus.
You got the esophagus right there. You guys see that there? So the motor aspect of this nerve helps with what?
Swallow.
Swallowing, right? That's the motor aspect. The sensory aspect?
Taste.
Taste. No, you got it? Okay, what happens if it's damaged? Can't swallow? Can't taste, okay? So tongue movement itself is something else. So watch out with that one, because tongue movement is a little bit different. There's a nerve that's specially created for tongue movement. This is more so for taste. On the sensory part, if you notice, at the very end, you guys see this nerve right here at the very end? Right? That's for taste, okay? And it helps with swallowing, but not tongue movement so much, right? There's another cranial nerve that we're going to see later on that deals with tongue movement. Okay? You guys good with this one?
Did you go over the patho and the clinical?
Yeah, patho, what happens? Yeah, we did go over patho. Patho, what happens? You can't swallow and you can't do what?
Taste.
If you guys notice the function of it, if it's damaged, what can't you do?
Can't swallow.
The function of it, right? So
Yeah, I thought it was just.
it makes sense, right? There you go.
I thought it was gonna be something special, so I was waiting. Yeah, fancy word or something.
Fancy word? Oh, I'll give you some fancy words if you guys want, but we'll keep it simple. No? Okay. So, can't swallow, can't taste, right? Now we good? Okay. We're finally double digits. We're almost there. Okay? Number 10. Vegas. I wish I could go there now. Oh God. Okay. The Vegas. Number 10. Is it sensory, motor, or both?
Both.
Both. Okay? What's it do? If you guys notice, it goes everywhere. It's down here in the medulla, but where does it go? It's the only cranial nerve that leaves the head and neck. You guys notice that? Because is the heart in the head or neck? No. Is the lungs? Is the stomach? Is the liver? Is the kidneys? Are the intestines? No. So it's the only cranial nerve that leaves the head and neck. Okay? So it's a very long nerve. It's called the vagus nerve. It's going to innervate what?
Visceral organ.
All the visceral fibers in your visceral organs. Okay? So everything that deals with, your stomach's feeling and moving and all that kind of stuff, your intestines, gallbladder, liver, heart, lungs, all the viscera, who's in charge of that?
Vegas.
Vagus. Okay. Is that motor? That part is motor, right? Okay. What's the sensory aspect of it? The sensory aspect is a little bit tricky. We have what are called baroreceptors in the carotids. So look up there up top. Do you guys see the carotids? You guys know what the carotids are? They're arteries. Yeah, there you go. Right up in here. And they have baroreceptors. Baro means pressure. So they sense pressure. So what do you think is going to happen? There's more 202 stuff coming up. On Monday, right? Monday we're going to hit this hard. Just watch. Just watch on Monday. Goodness, we'll just watch. I got all this stuff planned for you guys on Monday. Monday. I'm waiting for that day. We have baroreceptors up here in the carotids, right? They respond to what? Pressure. So if you put pressure on these baroreceptors, is that sensory? Yes. That's the sensorial aspect of it. So what do baroreceptors do with blood pressure? They're going to do what? Dilate, right? That's why when you do pulses, you never do this. 2 or 2. Because what are you doing? You're not getting oxygen, you're giving carotid massage. And if you give a carotid massage because of the baroreceptors, what happens? Your blood pressure drops. And if someone who has low blood pressure, if their pressure drops, they can faint on you. Okay? So that's why, clinically speaking, not Darth Vader, right? Okay, that's the wrong way to do it. Okay? Or not one. We're going to learn that in 202, just so you guys know. But I just wanted to highlight the sensory aspect of it. Isn't that kind of cool? I think it is, right? What's the imbalance? What's the imbalance? If it's damaged, what can't you do? Talk, because your larynx is innervated by
So
it.
basically it's like laryngitis.
Laryngitis, exactly. Laryngitis, if you want to get fancy with it, any difficulty in speech and swallowing. Think about all the things that it innervates. So if it moves digestive organs, is it not going to move digestive organs? So you're going to have paralysis, right, of these digestive organs. Okay, it's the opposite effect.
The patho was.
The patho would be impaired digestive system motility.
Oh, God.
Okay, because what's it do? It mobilizes, it moves the digestive viscera. So if it's damaged, what can it do? Move the digestive viscera. It's the exact opposite. Okay? Okay. Motility, movement.
What's the testing for that?
The testing for this one here, basically it's going to be the same as glossopharyngeal.
Okay.
So glossopharyngeal.
Posterior.
Oh, did we go over this one? The testing for this one?
The
No.
number 9. I mean the 9.
9.
So
So
it's the posterior two-third.
yeah, 2/3. But
Okay.
to test for this one, guys, this one is important for you guys to know too. So for glossopharyngeal, let's go back one because Will Knight reminded me about the testing. For this one here, this is glossopharyngeal. We went back one. We were on the vagus. We're going to go back one to glossopharyngeal. Testing for it. You guys know what this little dangly thing in the back of your throat is called?
Uvula.
Uvula. If this nerve is damaged, you're going to have asymmetry on the uvula. You should see symmetry. If it's damaged, it'll be to the side of damage, right? So we're looking for the uvula. We also test with the glossopharyngeal. You know when the doctor says, or the clinician says, say ah, and they put the palatine popsicle stick in your mouth and you almost gag on it, right? That's the gag reflex. Who's in charge of the gag reflex? This cranial nerve right here. That's an important test to kind of keep in mind and note. You're not going to make him throw up, by the way. You're not going to make him gag literally, but you just want to see the uvula move up, right? You guys have seen that too on yourself, right? Or someone's sick or something like that. Uvula goes up. That's the initiation of the gag reflex. Okay. That's how we test for that one. For 10, the way we test for it is the same way. It's tested together. Will not.
Okay.
Tested the same way. So you're looking for what? Uvular symmetry. Yes, the uvula is symmetrical. The patient's going to stick out their tongue. And, oh, not stick out their tongue. Sorry. That's not it. Why are you confusing me? Stop it. Basically, talk and cough. So you're going to ask the patient, can you talk? Can you cough? Say a few words. Obviously, you don't have to say that because they're talking to you, or they're not. But speak, cough, and look for that symmetrical uvula. And the most important thing is the gag reflex. That's the big one, the gag reflex. Okay? For both of them. They're tested concurrently at the same time. Okay? That was a good question. 11 is the accessory nerve. Is it sensory, motor, or both? Motor. It's going to innervate two muscles. What two muscles?
Neck and traps.
The traps and the sternocleidomastoid, right? So how do we test for this clinically? If you guys notice, basically going against resistance. We said the sternocleidomastoid, when it works unilaterally, it's for rotation, right? And the traps, basically up, right? So shrug. So we're placing our hands on the patient, as you see here, and we're testing for this cranial nerve to see if they can go against resistance. If they can't do it, what does that mean? There's injury or damage to this cranial nerve. Lift weights? Go lift some weights. I know.
What's the function?
It's going to innervate these muscles. It's going to innervate the sternocleidomastoid. It's going to innervate the trapezius. Okay? That's the main function of this muscle. Good?
Did you go with your patho?
Yep.
Okay.
They can't shrug and they can't turn their cheek. Because that's what the muscle does. Tell me when you're ready.
Ready?
I heard a hold on.
Thank you. There we go.
Oh God, it's 12. Hypoglossal, right? The last cranial nerve. Don't have a stroke. She's like, don't have a stroke on me yet. After class, but not during class. 12, hypoglossal. Where's this cranial nerve? What's it doing? What's the function of hypoglossal? Now we're talking tongue movement. So when you guys have a chance, review your notes and look at how many cranial nerves deal with the tongue. I think it's 3 so far, 4 maybe, 5. There's a lot of action with the tongue. This one is specific to tongue movement. You're going to ask the patient to stick out their tongue. You're going to look for symmetry, right? If it's asymmetrical, right, that means what? Damaged, right? That's your patho. So you're looking for symmetry. So testing it, how do you test? Say, stick out your tongue, and let's see symmetry, okay? So what's the function? Is it sensory, motor, or both? Motor. So what's the function? Movement of the tongue, right? So this is specifically for movement of the tongue. And again, you can see where all these nerves are hitting on the tongue, okay? Tongue movement. When we lose size of something, what is it called? Increasing size? Increasing size is hypertrophy. If we decrease in size, it's called atrophy. So if that nerve, like the trap, like I like what Andrew was saying earlier, kind of stuck with me. With the traps and the sternocleidomastoid, if the nerve is damaged to the muscle because the nerve is supplying the muscle, what's going to happen to that muscle? It's going to do what? Shrink. It's going to atrophy. So you're going to see an atrophy trap on one side maybe, or limb or whatever it might be in other cases of nerve damage, and then a normal sized muscle on the other, which is really interesting too. That's called atrophy. And then ptosis just means drooping in all circumstances. So we already talked about one type of ptosis before. Okay? Good? So, what I want you guys to do is just redo your notes later. I don't even look at them. Before you guys leave, I was going to check off your notes while I'm here. I want you guys to redo your notes nicely. Yeah.
You go over the pathos for 11?
Neatly and nicely. 11?
Yes.
Okay. 11 real quick. Is this 11?
Yeah.
Yeah, so patho here, if it's injured, right, they can't turn their cheek to one side or the other, and they can't shrug.
There you go.
Okay, any further questions or concerns that we have about this particular lecture series? Good job toughing it out because it was horrible because the AC, right? This is the sign-in sheet for the potluck stuff. If you guys want to sign up for it, I don't know how you guys want to do it if it's going to be Wednesday. If you guys are going to bring your own dishes or coordinate, email me if you guys want me to bring anything. Let me know, okay? But there's a sign-in sheet. Think about what you guys want to do. We'll do the video thing.